Hi, and welcome back. I'm Dr. Hakim, consultant orthodontist, diplomate in the American Board of Orthodontics, and I'd like to welcome you back to our fourth episode in this series. The last episode was regarding treatment of adults, and thank you for all the feedback. We had some great questions, and today we're going to tackle the subject of orthodontics and dental health and how it relates to general health. So come on, let's smile healthy. Once again, I'm joined by my colleagues, Dr. Anna and Dr. Omar, as we tackle this subject, dentistry, orthodontics in particular, and general health. What's the connection? What's the relation? Studies have shown having great oral hygiene and oral health is going to reflect positively on your general body health. But more specifically with orthodontics, what's the connection? So we have subjects like airways, we have things like chewing capacity, we have joint pain. So there's a lot of things to discuss. So we'll try to touch on it briefly. And once again, if you have any questions, any comments, please reach out to us, and then maybe we can address those in future episodes. So tell me, Dr. Omar, as an adult who's undergoing orthodontic treatment and you're having a mini screw supported expander, can you tell us why you did it and how it's changed your life?
Yeah. So it's like you mentioned, one of the reasons that why we do orthodontic, if it affects general health, it's to do with biting, chewing, mastication. I have what we call a crossbite. When it comes to chew, you could say.
Could you tell our for those in our audience who don't know what a crossbite is, what a crossbite is?
So a crossbite is basically when your lower teeth overlap your top teeth. To make it simpler, you're supposed to have your top teeth hugging the bottom teeth.
Okay.
But people with crossbites, such as myself, have it the opposite way around, when the lower teeth are the ones that are hugging the top teeth. It's even more of a concern when it happens one side, because, we get some shifts happening with the jaw. It's like they bite down, shifts to one side, and that can cause problems to people. Could attribute to joint pain. Now, of course, that's with everything we do, looking if we enter joint, it's a multidisciplinary thing, because it's not just teeth that could be the reason why we're getting joint issues. It could be the cartilaginous discs. It could be the muscles that you've got are hyperactive. It could be just the joints not meeting with each other. So as you mentioned, it's we're looking at the full health approach into things. And where we can do things is if it's the teeth related problem. If we want to, let's say, expand, like in my case, I've got that crossbite on both sides. I've noticed while eating and chewing, I actually have a problem. I chew quickly because of that. It's I have two bites and swallow because it's uncomfortable to just.
But during treatment, are you noticing any changes?
Yeah, it's very interesting to see. I think recently I've came to my 12th or 13th turn on the expander, and on my aligner I'm on number 12 as well. And just now, funny enough, I started noticing that I am biting on my premolar area canine, where initially a lot of the force was just anteriorly for me on my front teeth. It was just banging in the middle, always putting force there. And now, after breaking that 10th mark of turns and expander, I'm noticing it now. I'm getting more balanced on the side as well. Okay. Strange at first, but it's actually a more comfortable experience. So I'm glad with that. And that's the reason we do things. So that's by eating. More prominent, some people have their front teeth, they don't meet. They have what we call an open bite. The two front teeth don't meet, so they have a gap space. And we know with these people, they have problems with drinking water or eating anything like noodles, or can't chomp on a sandwich because their teeth don't meet. When they're out in public, you see them, sometimes they're shy to eat because water or food can leave their mouth. So yes, orthodontics can be done, not just for an aesthetic reason because they have a gap, but no, for a functional reason. So they have easier time masticating and eating food.
Sure. So obviously, function is a very important key factor in this. And like I mentioned earlier, a lot, you know, the bacteria in the mouth, periodontal health, like gum health, these are all key indicators and have an impact on general health. But obviously, as orthodontists, we want to fix to orthodontics.
Yeah, on the teeth.
So the other, you're having an expander and it's improving your bite. We're getting questions. We're getting people asking us with regards to airways and the ability to breathe. Now, coming from Brazil, and believe it or not, Brazil is the only country in the world that requires a check for a tongue tie at birth. And you've had great experience with this, with your past experience. So could you please explain to us this whole connection between airways, tongue ties, and orthodontics?
Yeah, sure. So, as you said, actually, I didn't know about this information because it's a common thing there. My mom is a pediatrician, so she's at the hospitals. She gets like the newborns, and she always told me that that's something very normal to happen. And in the team, the hospital team, there is a dentist always checking for that. So I do have a lot of friends and like working colleagues that they approach that area, and it's very interesting because, as you said, it's related. Everything is connected. Airway, dentistry, and everything coming together, it will help improve the patient life. Again, it's a topic that requires some teamwork. So we don't work alone. We need other dentists, like general dentists. They need to assess that as well. The airway approach, we need the ENT. So everything is connected so we can give the best solution for the patient. Sometimes one of the solutions is related to us. So sometimes the problem in the airway is actually related to us, to expand the maxilla. And that's where we come in. But first of all, I think the most important thing is to diagnose properly. So to really assess that. So that's why we need this multidisciplinary approach for like the airway, and then we can get to our part.
Yeah, I think it's crucially important that once again we touched on this in one of the earlier episodes, that every treatment has to be unique for the patient based on the presenting findings, and it doesn't make sense when every single patient is treated in the same way because everyone's unique. Yeah. And I remember when I first moved to Dubai. At the time, I had a patient came in, very, very common features, open bite, mouth breathing, and I referred the patient for the ENT evaluation because once again, the protocol that we follow is, you know, there cannot be any kind of airway treatment without the involvement of an ENT physician or ENT doctor.
Yeah.
And to my surprise, the ENT doctor replied and said, this patient can breathe through their nose without any difficulty. They're actually a habitual mouth breather. So they can breathe through the nose, but they just choose to breathe through the mouth. So then here we had to retrain and we had to use modalities that would kind of make it easier or more favorable for the patient to breathe through their nose. So it's not just because they breathe through the mouth means that they can't breathe through the nose. And I think identifying what the case needs is crucially important in the management of any patient that presents with a health concern as well as a dental concern. Now, another subject that we sometimes find, and it's very unfortunate, is patients who are receiving treatment for oncology in cancers.
Yes.
Or patients taken biphosphonate treatment. So all of these treatments does not disqualify them from orthodontics, but the involvement of the physician is key.
Yeah.
And without that, we cannot proceed with treatment. No. And then additionally, diabetes. And we often get asked, am I too old for treatment? Well, if a patient who's an adolescent even, and they have uncontrolled diabetes, we can't do orthodontic treatment for them. Yeah. And that would actually disqualify them. So even though they fall in that so-called ideal age for orthodontic treatment,
There are other reasons, other things
because
involved.
their diabetes is not kept under control, we're actually doing more harm than good. So I think it's very, very important to keep this in mind. It is a team effort. I think if everyone focuses on the best thing that they can do and collaborate and refer and work as a team and make friends with other colleagues and really appreciate what the other specialists in the fields, whether medical or dental, do, I think we can provide better care for our patients, and I think this will be a fantastic way to move forward.
And even the other way around, there are many research, we were talking about that recently, that connecting, for example, Alzheimer's disease related to bacteria that are present in the periodontal whenever there is periodontitis. So we keep seeing those researches more and more, saying that pretty much everything is connected. So we need to be we need to be aware of that, and again, having a good oral health and having a good general health. Anyway, everything is connected.
I think I want to raise 2 points on exactly what you mentioned. We're all, as you say, specialists in the field that we do. Like you mentioned, bisphosphonate cancer patient. Unfortunately, I've got 2 patients. The post-cancer treatment, thankfully the treatment went and all that. But again, I'm not an experienced oncologist, but reaching out to their oncologist for one patient, they gave me the green light to do treatment. They're like, this patient now is all well, medications as they say, is out of the system. Please go ahead and you can go with the orthodontic treatment. And yes, it's working, noticing a bit slower, maybe a moving stuff, but we take it bit by bit to reach there. The other patient, on the other hand, again, post-finished treatment, when I reached out to the oncologist, I was under the impression I'll get the green light like the first one. But his oncologist mind is like, please don't start. I actually would like to give him another year of nothing, let medications all wean off, slow it up, and then please reassess him after that. Of course, yes, I had one case where I had to go the green light, but I'm not the expert. So if that patient's oncologist told me to wait, hold the brakes, wait, we're not in a rush. The person's general health, I would say, is the top level. We should make sure whatever we do is to the benefit, not to the harm.
Fantastic.
And Dr. Anna mentioned a very important point, which we don't forget as well, is throughout, especially our orthodontist treatment, is our general dentist friends.
Yes.
Patients with us should not forget to see the general
Not
dentist.
because,
We always see it. They're
Yes.
cleaning. If there's any caries that might pop up throughout treatment, we look at everything. Our focus is the orthodontics, but of course, someone who does something every day will be better at catching things than other people. So
Absolutely.
general dentist needs to be your friend. Keep visiting your local dentist for the cleaning, for any decay that might pop up, just to make sure we don't create more problems. The sense of everyone stays healthy, stays happy.
So there you have it. I think it's very important that both the general physician and the dental general dentist have to maintain their relationship with the patients. We have to make sure that the general health is maintained. I worked with a hygienist who would actually score the patients based on how well they were keeping their teeth clean. And in the event their hygiene wasn't kept to the standard, we could actually stop treatment early, discontinue treatment without finishing, because it would be more detrimental to continue with the treatment than in the environment that is bad or with poor oral hygiene than the benefits that we would get from finishing the treatment.
Exactly.
So I think it's very important to keep that in mind. I think the general health is key. The dental health is key. They're all connected. As a specialist, my role is to perform one aspect, but maintaining general health takes the whole team. So with that, remember, don't just smile, smile healthy.